So, imagine you are sitting there having a conversation with a friend, and suddenly the words coming out of their mouth don't make sense anymore. You try to tell them, but you can't form words yourself. The vision in one of your eyes gets blurry or even dark. You try to point to your face to tell them something's wrong, but you can't lift your arm. What's going on? Well, it could be a stroke. It could happen to anyone at any time. The American Heart Association News says that strokes are the world's #2 leading cause of disability. And the best thing that can be done to help a stroke victim's outcome is to act fast. Now, FAST is a simple acronym that could save your life, or it could help you save someone else's. So this is a simple acronym that is used to help people recognize the common symptoms of stroke. Because once symptoms have been recognized, treatment can begin. This fast recognition and response is what will give a stroke victim the best chance at having a normal life after recovery. So, like I said, the first thing that has to happen is recognition. The National Stroke Association says that FAST is an easy way to remember and identify the most common symptoms of a stroke. FAST stands for facial droop, arm drift, slurred speech, and time. So now you're on the flip side. You're talking to a friend and suddenly they get a glazed stare. You might notice that one side of their mouth is hanging lower or open, and one of their eyes might not be able to open all the way. This would be a facial droop and could be a sign of a stroke. What you would need to do at that point is ask them to lift their arms in front of themselves. One of those arms might drift off to the side, quickly drop, or they might not be able to lift it at all. Next, note their speech. If they can talk at all, they might have slurred speech, or they might not be able to form words and maybe only make sounds. Lastly, note the time. Time is very important because this is how hospitals will determine their mode of treatment for a victim. So it's very important that if this happens, you need to let either the first responders or the hospital know the time that you saw the symptoms start. So there are two types of strokes. There are the hemorrhagic, which is a brain bleed, and then there's an ischemic. This is a clot in an artery in the brain. This type of stroke, along with the amount of time since the onset of symptoms, is how they'll determine how to treat the stroke. So for an ischemic stroke, just this year there was a new guideline that came out extending the window of when they can have what's called a mechanical thrombectomy. Now this is when a surgeon will go in and physically take the clot out of the artery, restoring blood flow to that portion of the brain, which would then restore oxygen and sugar to it, allowing it to function again. So the American Heart Association says that the limit for this used to be 6 hours for patients to be a candidate. Now, some patients may have clot removal up to 24 hours after symptom onset. This is really big news because prior to this, if a person goes to sleep at one time and then has an 8-hour night, which is a normal amount of time before anyone sees them, and then somebody finds them with stroke-like symptoms, they are already outside of the window. So if somebody wakes up with stroke-like symptoms, likely their best mode of action is either a more dangerous drug or physical therapy, which will have nowhere near the impact that this mechanical thrombectomy does. So this could change the outcome for stroke victims drastically. So obviously the goal here is for everyone to make it home and have as much independence and as few restrictions as possible. We do this by recognizing the stroke quickly with the acronym FAST: facial droop, arm drift, slurred speech, and time. Once it's known, these new guidelines should push the patient in the right direction of a full recovery. And Dr. Jose Biller, the guidelines author and chair of neurology at Loyola University Chicago, says up to 20% of stroke patients are currently eligible for clot removal. This number we expect and hope will grow with these new guidelines and with further research. Thanks.
Now, Suzanne, you guys gotta outro yourselves.
I'm Suzanne. I'm still Dave.
I'm Robert.
I'm Marsha.
Junior.
Thanks, guys.
Jay.